Welcome to the Healthy Kids Minute.
Child abuse can come in four different types, really. There can be physical abuse, sexual abuse, emotional abuse, and neglect.
Dr. Robert Knoll is the Director of Pediatric Hospital Medicine and Emergency Care at Crozier Chester Medical Center. He points out what signs people should look for if they suspect that a child is being abused.
Signs of physical abuse may be in some ways the most obvious. They could appear as bruises, welts, marks on the skin, bite marks, fractures, black eyes. Sexual abuse may present as children who have, beyond their developmental abilities, sexual acting out or play that doesn't seem appropriate for a child of that particular age. Those children can also sometimes become withdrawn and change in their demeanor and the way that they interact with other adults. Children who are victims of emotional abuse may also be withdrawn, but in some cases those kids can present as having extremely passive behavior or extremely aggressive behavior. They may be acting developmentally inappropriate.
But the most common form of abuse is child neglect, which Dr. Knoll says makes up about 64% of reported cases.
Sometimes these are kids that are not wearing clean clothes and haven't bathed and aren't being taken care of properly, and so those things can be pretty obvious.
Dr. Knoll says if you believe abuse is taking place in the life of a child, you should report those suspicions to a local county children and youth services, or in Pennsylvania, you can call the 24-hour statewide child line at 1-800-932-0313.
We know statistically children who have been abused, whether physically or sexually, are more likely to grow up to become abusers as adults. So if there is an impact that can be made, it may put an end to that cycle of abuse.
This has been the Healthy Kids Minute.